the introduction is you will get to know the different programs where the government is trying to decrease the morbidity and mortality of the diseases. And these two terms, morbidity and mortality, what are these? Do you know what are these words? Morbidity and mortality. This morbidity and mortality means how much percentage of people is infected or diseased by a specific disease. This morbidity and mortality, how much how percentage of people died because of this disease in particular period of time. This is mortality. So here is the programs for communicable diseases. There are various programs are going on. Among them, the most important one program is National Vector-Borne Diseases Program. Okay, can you name some vector-borne diseases? Malaria, then? Dengue, yes. Malaria, dengue, filariasis, kala-azar, chikungunya. These all are vector-borne diseases. So, in malaria, the strategy of this schemes were the disease management, integrated vector management, supportive intervention, and environmental management. So here, the plan was to reduce the Japanese encephalitis and dengue malaria by half of the cases. Okay. Then elimination of kala-azar by 2010 and the elimination of lymphatic filariasis by 2015. Okay, so these cases already, old cases, already India got some diseases already eliminated from India. So here I will discuss about the National Anti-Malaria Program. In 1953, the first National Anti-Malaria Program first was introduced in India by 1953. At that time, the objective was to reduce the morbidity, and gradually time increases, and next objective was to ending the transmission of the diseases and killing the vector, elimination of reservoir of the infection. It was introduced on 1958, and finally the National Anti-Malaria Program was introduced on 1999. Okay, the National Filaria Program was introduced by 1955, and what causes filaria? Filariasis? Uchiria Brenkofti, Brugia Meli, Timori, these all the other, So the basic idea you have from class 12. So the control measure assessing the extent of the problem, how much extent of the disease occur in the society, treating and diagnosis with DES. DES means diethyl carbamazine, and control the disease by anti-larva, anti-parasite measures in urban areas. And IEC activities are also going on. What is IEC? IEC is information, education and communication activities. It's under all central government scheme which introduced in different programs to control the diseases. IEC activities. Okay? Now I will discuss about Kala-Azar program. It was introduced around 1990 to 91. Kala-Azar, also known as visceral leishmaniasis. Okay, so it was goal to eradicate by 2010, and action was to reduce the vector and early diagnosis, treatment, and providing the health education among the people. Okay. Japanese encephalitis, the program started on 1978. It is also caused by mosquito. It is viral diseases. And dengue fever control, it is also were first initiated by Department of Health on 1993. Chikungunya program, I am talking about the first point, National Vector-Borne Disease Control Program. These all I am talking about is come under this program. So there is chikungunya outbreak was in 2006, and then it was controlled. Now under this program we are providing the symptomatic treatment and the education regarding how to provide, how to when to go to doctor, how to get in correct time you get treatment. So here, next point, revised National Tuberculosis Control Program, RNTCP, is very important because RNTCP, under RNTCP is very important topic is there, is DOTS. DOTS full form, can you tell? Directly observe, short course, treatment but therapy, short course. Directly observe, therapy or treatment, short course. So the treatment was given is given under the healthcare providers, under the observation. So इसका जो एक slogan है वो पूरा कोर्स पक्का इलाज, ठीक है ना? तो RNTCP was it is revised program. Before that it was launched around 1962, and 1992 the revised guideline and program was launched. So here, you know, the World TB Day celebrated on 24th of the March, and the main office is Bengaluru. And here you will study regarding, you have to study regarding the DOTS, RNTCP, MDR, what is multi-drug resistant. It's a huge chapter. You will open the book and you have to study. Okay, it itself will take a half an hour class. Okay, I will not discuss that much because I have many more things to tell you. Then you are also tired, no? Okay, so improving the laboratory facilities, sputum collection, laboratory facilities should be top notch, and the new techniques are coming in laboratories. So they have to introduce in the labs the new techniques and what machines are coming, and then implementation of dot plus therapy for those who are multi-drug resistant. Multi-drug resistant TB patient, they will introduce dot plus therapy. Okay. The objective of RNTCP is to detection of cases by 70%. माने 70% cases detection होना चाहिए through this program. They have aimed object, and to cure the patients, TB patient, by 85%. Okay. So this is next is National Leprosy Control Eradication Program. It's launched around 1955. Object to remove leprosy from our country, and India already achieved leprosy free and elimination of the leprosy achieved by 2005 December. So decentralization and institutional development, strengthening delivery system, all are included in this program. Next, National AIDS Control Program. National AIDS Control Program. There are 3 phases of National AIDS Control Program. The first phase was introduced in India by 1987. The second phase was introduced around 1999 to 2001. My speed is little. I should go little. Okay. So phase 2 was introduced in 1999 to 2001, and the last final phase was 2006 to 2011. So what are the aim to AIDS control program? To prevent the transmission of the diseases, to educate the patient how it get infected and spread. Yeah. In social, there is lots of discrimination and stigma regarding this health, AIDS, HIV/AIDS. Educate the people, educate them what is correct or not. These all are included in this program. In policy also, AIDS policy is there. These all are included in these programs and policies. Okay. Next, universal immunization program. Under this immunization, national immunization schedule for the babies and the newborn, the mother, pregnant woman, adolescent girl, especially mothers, pregnant women, they are getting TT, babies also, and different time there is new vaccines are launching, experiment is coming, government has particular schedule, but in various time they introduce Japanese encephalitis, yellow fever, many more vaccines, pneumonia vaccines. So the upgradation is controlled by this national universal immunization program. Okay. How it spread, how this mainly these programs are for educating the people. Okay, the eos is a bacterial infection, is skin, bone, cartilage, all are infected by this bacteria. So eos are already eliminated from India by 2004. It got elimination. 2003 last case was detected in India, and WHO already declared India was free around 2015 and 16. Then integrated disease surveillance program. So from this verse you can get to know disease surveillance program means they collect data regarding this different type of diseases. Now you think there is a outbreak, how much patients are infected, how much is severity, and daily death rate, how much, the correct data collection, and provide them to government hospital, private sector, NGOs. This all are running by this disease surveillance program, and there are 3 levels of this disease surveillance program. That is level 1, they work for 8 hours in a day. Level 2, they will work for 14 hours in a day. And level 3, there's a highest level, they work 24 into 7. Okay. So these are integrated disease surveillance program. Acha, this programs for non-communicable disease. I have mentioned the 8 major programs. There's many more. Programs for non-communicable disease. Now here we know National Cancer Control Program. National Cancer Control Program was launched on 1975 to 76. Okay, and it was revised on 2004. So National Cancer Control Program, can you tell me what is the highest cancer, the most common cancer in India people die from? Women, men, children. Breast cancer, yes. The second, cervical cancer. Men, lung cancer. Our babies are suffering maximum from leukemia. Okay. So under this program, the different type of screening come. In what age will start screening for cervical cancer, in what age you will check for pap smear and all, lung cancer, in which symptoms you can the perception of having any cancer, they educate the people first. So in all, in IEC activities come under all this. Acha, National Mental Health Program, it's launched 1985. You know about depression, depression, anxiety. Nowadays, youth are suffering many more and lots of cases. So we have to talk more and more regarding these symptoms. And this program, mental health program, they used to educate the people regarding this mental health issues, provide them good mental health care, medicines, and special clinics and all. Then National Diabetes Control Program, one of the alarming diseases in India now. By 1987, it was introduced or launched in India. डायबिटीज मेनली टाइप 1 का तो कुछ नहीं कर सकते, टाइप 2 वी कैन कंट्रोल लिटिल बिट, एडुकेट द पीपल हाउ टू लीड अ लाइफस्टाइल, ठीक है ना. सो ये among the non-communicable diseases, diabetes, cardiovascular disease, these are all important programs. One more program is there, control of diabetes, cardiovascular disease, stroke. Yeah, point number 6. So here the screening and provide the healthcare workers the special training, because every year different type of evaluation and lab facilities are coming. So yearly they provide training to the healthcare worker, how to screen the patient, how to detect the cases, any cardiovascular cases on diabetes. They are trying to give medicine and primary screening from primary healthcare, root level, from the root level. Then they are arranging special clinics, CCO, cardiac care unit, in different institutes. So these are all come under this program. The National Program for Control of and Treatment of Occupational Disease. Occupational number 4. Acha, can you name some occupational disease? Huh? Sclerosis, silicosis, asbestosis. Huh? Sit down. Then lung. Then yes, you can get. And different type of workers working on many hours in a noisy environment, they will get hearing loss, lung cancer, and some other psychological issues are there, mental problem they also get. They are not getting enough sleep, and hours of hours they are working, they are far from their family. Psychologically they are also get affected, and counseling should be there. So here the program actually work as a research work. They research on this various level, what to how to overcome the diseases, when to take them to health hospitals and all. These are all are come under these programs. Okay. Then national program for control of blindness. Here one is permanent blindness or blindness. Which vitamin deficiency cause blindness? Can cause yes, A. So trachoma also con blindness. Vitamin A deficiency also is different causes. So here in India, first in national program for control of blindness, first it was uh, trachoma control program. It was taken around 1963 that it was launched. Okay. And then it was upgraded into prophylaxis program against blindness in 1970. Then again it was revised, and then it was in 1976 the final national program for control of blindness. Okay. So here one popular short note it will come, the vision 2020, राइट टू साइट. एक हम लोग के टाइम पे शॉर्ट नोट आता था, आई डोंट नो, बट यू हैव टू study all of these important punch words and lines. You have to know what is the punch words in this dots, RNTCP, dots, MDR, TB. This you have to study and give stress on these topics. Okay. I think it's over now. Deafness. Okay. National nutritional programs. हाँ, नेशनल न्यूट्रिशनल प्रोग्राम्स पता चलता है, ये न्यूट्रिशन डेफिशिएंसी रिलेटेड ही प्रोग्राम है. हाँ, सो फर्स्ट इज मिड डे मील प्लान. मिड डे मील प्लान, अनदर नेम ऑफ मिड डे मील प्लान, प्रधानमंत्री पोषण, हाँ, यू नो, प्रधानमंत्री पोषण, हाँ, शक्ति निर्माण. ओके, मिड डे मील, what are the objectives? Why midday meal was introduced? Because in rural areas, many parents will say, I will not send my children, there is no money to provide them good food and shelter, how can I send them to school? Here is a very good initiative, because a big percentage of from urban slums and rural area, babies are coming, children are coming in the primary school and schools, and they get one day meal, at least one meal in a day. So here the meal pattern is, you will provide good protein, carbohydrate. त्रिपुरा का मेनू पता है तुम लोगों को? You know what's the menu? 2 days egg meal, 2 days vegetable meal, खिचड़ी भी provide करते हैं, and the fruits, then eggs वगैरह. ठीक है, स्टडी करना है, ये थोड़ा इजी टॉपिक है, मगर यू हैव टू गो एंड सी इट एंड स्टडी लाइन बाय लाइन. नेक्स्ट टॉपिक इज इंटीग्रेटेड चाइल्ड डेवलपमेंट सर्विसेज स्कीम. ठीक है, इट वाज लॉन्च्ड in 1975. It is also short form as ICDC. It is India's now, it's the world's largest scheme, community-based program, world's largest community-based program, the Integrated Child Development Service Scheme, ICDS. So ICDS, world's largest community-based program. Here, who are coming under this program? From pregnant women, then adolescent girls, and the babies, children, all are coming under this program. So they basically look after the nutrition. In pregnancy, nutrition is very important. They educate the people how to get proper nutrition, try to decrease the low birth weight and all. The pregnant woman, you know what are the most common cause of mortality after delivery? What should be after delivery? Tell me. Huh? ना आफ्टर डिलीवरी इट इज न्यूट्रिशन बाद में आएगा. इट्स इफ ए पेशेंट इज एनीमिक, लो न्यूट्रिशन, ये तो डायरेक्ट डेथ नहीं होगा, मगर इन लिटिल बिट ऑफ ब्लीडिंग एनीमिक पेशेंट deteriorate more. Okay, but if you are asked what is the most common cause of mortality in pregnant women, it is postpartum hemorrhage. Okay, postpartum hemorrhage means the bleeding, antenatal also antepartum hemorrhage, postnatal postpartum hemorrhage. These are most common cause of mortality, because this bleeding causes sudden death, and also embolism तो है, fat embolism, but इस बाद में आता है. But first is hemorrhage causes. So they will healthcare workers will get more, क्या बोलते हैं, education, and they will teach them how to manage in emergency condition. If any patient is bleeding, how to manage this situation. So in preschool bachas, preschool going, the study, then nutrition, all are come under integrated child development services. Special nutrition programs. Special nutrition mane here come under vitamin A supplementation. You know the dose of vitamin A given to the babies. Then come iron, folic acid is very important. So it's iron, folic acid and vitamin A solution. National nutritional, एक बच गया, National Nutritional Anemia Prophylaxis Program. The anemia, can you tell anyone, tell me the definition of anemia? Anemia definition is anemia. So after decreasing in net blood cell, what happened? Huh. Drops, yes. Anemia basic concept is the quality of red blood cell, amount of red blood cells, all this will decrease. The production house maybe is infected, that's why the causes are different. The main इतना बड़ा chart है causes का. So anemia, it will decrease the oxygen level in the body. This is anemia. Anemia normal range तुमको पता है? What is the normal range? Pregnant women and children, it's 11, less than 11, it's anemic. And in men, how much? कौन बोला? Okay. And normally female have how much? 12. Okay. So it's the basic idea which patients are anemic and all. क्या बोलते हैं, एनीमिया स्कीम के अंडर आता है डिफरेंट टाइप ऑफ एज लेवल come under this program. Adolescent girl, pregnant, reproductive age group, National Iodine Deficiency Disorder Control Program. The National Iodine Deficiency Disorder Control Program, it is iodine deficiency. Can you tell me what are the iodine deficiency, what causes? What are the causes of iodine deficiency and what are main cause? अरे मेन कॉज है आयोडिनाइज सॉल्ट नहीं ले सकते, इसीलिए आयोडीन डेफिशिएंसी हो रहा है, ठीक है ना. So the quality of iodine is monitored by this scheme and the program. Everyone should get iodinized salt and the deficiency should be corrected. So what disease is caused by iodine deficiency and which gland is affected by iodine, less iodine? थायराइड. तो थायराइड बड़ा हो जाएगा ना, थायराइड प्रोडक्शन चाहिए बॉडी को. लेस आयोडीन, बॉडी नीड मोर थायराइड प्रोडक्शन, इट विल इंक्रीज इन साइड. तो व्हिच डिजीज इज कॉज्ड बाय आयोडीन डेफिशिएंसी? गोइटर. सो फर्स्ट गोइटर वाज फर्स्ट इंडिया गोइटर बोलते हैं गोइटर कंट्रोल प्रोग्राम वाज लॉन्च्ड, ठीक है. So in India first launched goiter control program. It was not named as iodine deficiency disorder control program. Goiter launched, it was 1962, ठीक है. बाद में ये हुआ this iodine deficiency disorder control program. Okay. Okay. Programs related to system strengthening welfare. ओके चलो, फर्स्ट आता है नेशनल रूरल हेल्थ मिशन, NRHM. It's a very common in it. From the mission itself, the name, you will get the information that. Good afternoon, sir. It was launched in 2005 April. The more affordable, accessible healthcare and quality of healthcare should be increased in root level, in primary level, in the which people are belonging to poor society and poor socioeconomic status. They used to they can't provide high profile investigation and all. Though under this scheme, they are giving some budget friendly and okay, sir. So here, okay, sir. Under NRHM, they are providing the affordable and accessible quality, more quality having services to the poor people. Okay, and second point come reproductive and child health program. In reproductive child health program, it was introduced in India on October 1997. Here, the reproductive age, the women who are under reproductive age money from after the age of 14. 15 it starts and it's up to 49 years. Reproductive age, under the reproductive age women and child health program means the people who are in the women who are under this age group, and girls, adolescent girls, the children, they have various diseases they suffer from, and it causes mortality. The main function of this program is to reduce the mortality of them. They provide them good healthcare services. National water supply and sanitization program. So have you heard of a Swachh Bharat mission? It's very popular, no? So it was introduced in 2014. Okay, so open defecation also India, open defecation free in 2019, it is also come under this program. Then normal in rural area, under this program, they are planning to introduce tap water in every family by 2024. Okay, and Bharat Nirmal also, one program come under this water supply and sanitization program. It was introduced around 2005. Okay, now the important program is 20 points program. It is TPP. What is TPP? It was introduced in 1975. It is very importantly, they are improving the quality of the all people in the society. How? They will look after the education, housing, agriculture, and their economic, कंज्यूमर जो होता है ना, प्रोटेक्शन एक्ट वगैरह वगैरह, सब कुछ कम अंडर दिस प्रोग्राम. दे बेसिक target is improve the quality of the life, TPP. Okay, national health policy. Sir, I will take 5 minutes. Sir, can I take 5 minutes? 2 minutes. Okay, and this is national health policies. First, National Health Policy 2002. It was first introduced in 1983. From 1983 to 2002, this policy was going on. What it did, it provide the preventive, promotive, and public health rehabilitation aspect of the health. Now, number 2 is National Population Policy 2000. In 2000, it was introduced. The National Population Policy, mainly it will work on decrease the mortality rate. ठीक है ना? National Population Policy. Universal immunization, it will I have already told what is universal immunization. It is also come under this policy. And institutional deliveries, safe deliveries to the mothers, so the mortality rate will decrease. Then empowering the women. Okay, national AIDS control prevention policies, I have already told you. Then national blood policy, it was introduced in April 2002. So here they ensure adequate and good quality of blood collection centers, and new techniques or upgradation is coming. Blood transfusion, all are introduced under these programs and policies. And this much is in under blood policy. And national policy for empowerment of women, it was introduced in 2001. National policy national charter for children. What is come under this policy? It was introduced in 2003 to 2004. Uh, Under this policy, there is right to protect the children rights. Okay. And you see that there is some various abuses, so this policy will protect the right of the children. Okay, so for further healthy development, mental development of the children, they will provide all the uh, policies. National Youth Policy. It focus on the education, empowerment, employment. Okay, then health, social upgradation, and there are various type of social justice also come under this program. Okay, youth related. The education से लेके उसका job, उसका social welfare and justice all come under this. And national nutrition policy to ensure good proper nutritional health and nutrition. I have discussed 4 5 nutritional programs. They ensure the good nutrition quality among the people and provide a good health care. Okay.